There's two questions about what's happening nationwide, and I think Rear Admiral Bailey, you can help with this. First of all, are there any stats on which states require dental exams prior to enrollment in daycare? And secondly, Maryland is often used as a great example. Are there any other known success efforts in other states?
As far as other states that have successes, there are a number of other states that have had considerable successes. The Wisconsin comes to mind. Wisconsin Seal a Smile program has worked to raise the visibility of that essential preventive intervention. And just this year, the state legislature, in a time where the state is under some tough budget constraints, they appropriated $500,000 additional dollars for state sealant programs. The state of Arkansas passed a statewide fluoridation legislation that will now provide benefits of fluoridated water to people living in communities of 5,000 persons or more. And what was the first question? I'm sorry.
Are there any stats on which states require dental exams prior to enrollment in daycare?
Yes, and I don't have those in front of me, but if people on the call will go to the Children's Dental Health Project, they've looked at that, and I believe that they're available on that website.
Thank you, Dr. Bailey. Another very broad question for Dr. Coe. What is the Department of Health and Human Services doing to address oral health?
So I think I alluded to this oral health initiative that we launched in 2010, and again, Admiral Bailey and others have commented on the contributions of various agencies. We've talked about the contributions from CMS and Medicaid in particular. Admiral Bailey talked about the Indian Health Service and their early childhood caries effort. I did want to thank the CDC. We have some CDC colleagues in the room because they have given grants to some 20 states for state-based oral disease prevention programs. But this is an opportunity that I believe we can do more as a department and as a nation. And as I mentioned earlier, there is a new National Oral Health Alliance. And so we have been in discussions with them about whether we can take some of these efforts that were started in the department in 2010 and earlier and move them up a couple of levels. So those conversations are occurring now. And by including oral health as one of the leading health indicators, we want to show how important this is for our department in the country.
Thank you, Dr. Coe. We have another question for you, Jane Casper. Once priorities were identified for the plan, how did the MDAC and OOH determine where to focus implementation efforts?
Well, that was easy. There were already activities due to the continuation of the momentum from the DAC recommendations, and we looked for what Dr. Goodman has already said, the low-hanging fruit, things that were achievable considering our current economic atmosphere. And we are building on the resources we already have, such as the Oral Health Literacy Campaign that was kicked off in Maryland in March of 2011.
Thank you, Jane. Another question for you, Dr. Goodman. How are your various stakeholders and partners engaged in evaluation and planning?
Well, that's going to definitely come through the Maryland Oral Health plan, essentially, because we really have, in that plan, it's a very comprehensive plan. It gets into areas where we have made, maybe just medium progress, such as oral health for adults, as an example, which is something we're all striving for. But I think it's the implementation of that plan through the stakeholders, which is through the Maryland Dental Action Coalition, that's going to really help drive policy, help drive activities, and certainly in of itself serve as an ongoing evaluation of our progress. We're placing a lot of stake in that plan, and a lot of effort has gone into that plan and is still going into that plan as we speak.
Thank you, Dr. Goodman. A question for you, Rear Admiral Bailey. Can you speak about how a state would go about integrating dental care in medical homes, which are currently being created under the Affordable Care Act?
Well, first, you had mentioned that CDC funds states to build infrastructure and capacity. One of the recipient activities for that is building collaboration. So the first thing to do is to establish relationships and some kind of systems to integrate oral health into overall health. But once you start establishing those relationships, and children are regularly being referred by other types of providers to dental homes, then it's a process of finding the people that will take those children into dental homes. I know that one of the things that of the HHS Oral Health Initiative is to find dental homes for children, and over the past several years, over 1,000 new dental homes have been established, and it's just a lot of hard work. Really, it's knowing the dental network, it's knowing the other providers' networks, and it's trying to match these children with needs up to people who will do that. One of the things that the CMS is doing currently is their new national oral health strategy is developing state plans in all 50 states to look at this, to see how they can increase access to Medicaid children, to increase the numbers of children receiving the necessary services. And so these state plans are being developed under CMS's leadership.
Thank you very much. I regret that we're not going to be able to get to all the questions that have been submitted today. Perhaps we have time for 2 more questions. Jane, the next question is for you. Regarding the educational component, how did you get your coalition funded? Is it a long-term resource? Will the messages are the messages potentially available for other states to use for their efforts at educating their residents?
Well, yes. Actually, they can go on the website of the Maryland Dental Action Coalition. It's www.mdac.us. That will have the plan. And right now, we are looking into funding from various sources, grants that are available, because we will need resources, financial resources, to continue.
This is Harry Goodman. The coalition was originally seeded through our CDC cooperative agreement, and then it led to funding by the DentaQuest Foundation, and the MDAC now has actually applied for another grant, the Oral Health Alliance 2014, and has developed a very interesting Maryland Oral Health Learning Alliance. So they're going for that. They're really going for multiple sources of funding, and the fact that they have an executive director and a staff and the support of all the stakeholders in the state, I think, goes a long way to their sustainability. But it's always going to be a challenge.
Thank you, Jane. Dr. Goodman. Dr. Goodman, I'll give you the last question for the day. How do you plan to monitor policies, and how will you identify if policies need to be changed or revised over time? Well,
we actually developed a sort of a crosswork. One of our staffers who works on policies has really basically cataloged all our policies and basically is tracking them in time. And we basically look at that crosswalk from time to time and see whether they're effective, whether they're working. And again, those policies get almost woven into the state oral health plan itself, basically, because the policies that have been established really have become, in many ways, the goals, the objectives of the state oral health plan. We actually worked with the Children's Dental Health Project on developing a template to monitor policy, and it because of having that crosswalk template, it kind of keeps it on our radar. So policy has been very, very important to our state. We actually built our program off legislative and other kinds of regulatory initiatives. So it's something that comes pretty natural, but it's something we're always going to have to kind of monitor.
Thank you, Dr. Goodman. Again, I regret that we're unable to answer all the questions that have been answered today, but hopefully we've addressed a representative number. Let me end by thanking you for joining today's webinar. This webinar is part of a series, and we hope you'll continue to join us. Healthy People is looking for real stories from organizations that are working to make its goals a reality. If your organization is doing great work on specific leading health indicator topics, we want to hear about it. Go to healthypeople.gov to submit your story.